Hello, and thank you for joining me for this video. I'm Dr. Andrew Manista. I work at Olympia Orthopaedic Associates, and I will be talking today about shared decision-making in regards to lumbar spinal surgery. You may say to yourself, what is shared decision-making? Shared decision-making is the concept that you and myself are coming to a point in your medical condition where we are going to discuss your future. Surgery is a possibility for you now. That's why you're watching the video. And that means that the conservative efforts have failed to give you relief of your symptoms. Part of shared decision-making is reviewing those conservative efforts. In many cases for lumbar spinal surgery, this would include resting, modifying your activity, taking non-steroidal anti-inflammatories, doing physical therapy, home exercises as part of that therapy, and often epidural steroids or other adjuvants. If those have failed to give you enough relief, then surgery may be a possibility. When one talks about surgery, one needs to look at the risks and benefits of that particular procedure. What are the goals of that procedure? What are we trying to achieve? And what is the expectation of how soon those will occur, how often they will occur, and what is the statistical chances of that happening to us as a team going forward with your surgery? We'd like to provide you with informational materials to talk about your surgery, lists of what you can and can't do after surgery, materials that will help explain what the surgery is, or videos like this where we go into greater detail. As you get ready for surgery, we want to make sure that you're going to have the best possible outcome. And part of that is identifying who your care team is going to be. Who is your care partner? Who's going to help change your bandage? Who's going to help feed you when you're hungry? Things like that. It can be a relatively simple discussion if you have extended family and friends that are prepared to do so, or it can be more involved if you are alone and have limited ability to have care brought into your home. As we get ready for surgery on your lumbar spine, we're going to want to make sure that we take the best possible care of you, and that's going to be a process of taking care of the entirety of you. So we're going to want to review your allergies. Are there any medicines that we should avoid so as not to cause you harm? What current medications are you taking and what dosages, so that we can make sure that you're getting treated appropriately while you're under our care. Another one of those aspects is going to be, what are your wishes for end-of-life care? Some people have filled out living wills, and it would be an appropriate time to bring that to our attention. Other people may want to review the paperwork at that time and have those discussions with their families. Before surgery is the best time to do that. At Olympia Orthopaedic Associates, we are actively involved in research regarding the lumbar spinal fusion procedures. There's going to be a series of surveys that you will take before and after the surgery. Some of these survey periods are as long as 4 years after surgery and may include x-rays. As part of these procedures, it is our expectation that you will commit to filling out the surveys and having the x-rays done at the appropriate times. This will allow us to study these procedures and find ways that we can do it better and more safely for patients in the future. You'll be participating in making medical treatment safer. I think that's something that you could be proud of. In shared decision-making, we are, as a team, you as the patient, myself as a surgeon, discussing the risks and benefits of this particular procedure, in this case, lumbar fusions. It's important that we have detailed the risks as they relate to you. It's also important that we detail the expectations of the results, again, as they relate to your specific case. Once we've answered your questions and gone through the experience together, we'll sign a document called informed consent. And that document simply states that we've had a discussion and we've addressed what our expectations are, what the experience will be like, answered your questions, and that we both agree that we would like to proceed. Thank you for taking the time to go over shared decision-making as it relates to lumbar spine. Really wish you the best of luck on your procedure, and we'd like to thank you for your attention.